Without further ado, how did you get your start in healthcare?
I would say for me, I always wanted to be in healthcare. I would say I was probably one of those kids that always knew that I wanted to take care of people. So my earliest memory was probably at the age of 4,
Wow.
and wanting to be a pediatrician.
Oh, cool.
So I always wanted to take care of people, but specifically babies.
Yeah.
Is where I wanted to be. And so when I was in high school, my high school was a magnet high school. And so we had the opportunity to major in something. And so the particular area that my high school had, we had an allied health track. And so it had veterinary science, it had dentistry, it had medical office administration, and had nursing. And so our freshman year in this allied health track, you had to go through all 4 of those areas. And then at the end of your freshman year, then you could declare your major. And so I chose nursing because it was the only one that kind of resonated with me, and it got me as close as I could get to that medical side. And so I chose that, loved it, of course, had the opportunity of sitting for my certified nursing examination at the end of my senior year. But, of course, I still felt very passionate about being a pediatrician. And so then when I went to college, my undergrad, I attended the University of Louisville in Louisville, Kentucky. In my first year, still was sure that I was going to be a pediatrician. And so I was a biology pre-med major. And my first year classes were surrounded by all of those, chemistries and all of that. And my second semester, I looked at my list of classes, met with my advisor, and I saw that I was going to have to take inorganic and organic chemistry.
That one got me.
And I was like, no, I'm not going to take those 2 classes. And I remember meeting with my advisor and having a conversation with him. He was like, no, you're going to have to take those. And I was like, no, I'm not going to take those. And he was like, well, what else are you interested in? And looking back at that moment and having my fair share of mentees that I've sat with, I'm kind of disappointed that my advisor, seeing a student of my caliber, that he didn't push me. And that he didn't challenge me and didn't, afford me with some resources and didn't say, no, you're going to take inorganic and organic chemistry and we're going to get you there.
It's going to be as painful as you think it'll be, but.
Exactly. But I told him about what I did in high school and that nursing. He was like, I think that'll be a good fit for you.
Yeah.
And so that changed the whole trajectory of my life.
Isn't it when you can pinpoint those moments and really
exactly.
Exactly.
And that was for me that moment where that switch from that medicine to nursing for me, and never look back from there. So that for me is for where my start healthcare. I always knew healthcare, but the switch from medicine to nursing.
Right.
Change.
Yeah. Very cool. Well, you are a plugged in member of a lot of amazing things that are going on for BIPOC communities. If you can kind of give us right now, you have your finger on the pulse. What's the status of healthcare disparity right now? Well, that's a big question.
It is
a many-layered answer, but
it is. For me, I would say, as far as what I believe the status of disparities, our healthcare disparities, I would say that it's the hot topic, right? Everyone's talking about it. I would even say, that's the fancy girl in the room, and everybody wants to pay attention to her. But unfortunately for us in healthcare, this is no surprise to us. we've known about all of these issues with disparities. And it's, for me, it's a little disheartening that it's just now getting the attention that it's getting.
Right.
Because it's been a problem and been a problem for decades. But it's never too late to start putting the resources behind it. But as we said, it's been a problem.
Right. More than a buzzword for the people living it. Yeah.
Exactly.
Yeah. Well, in that same vein, what do you think the impact of COVID-19 has had on healthcare disparities? Another easy one.
Even more tragic. It has exposed it and made mainstream media and the average American pay attention. And again, as I just mentioned, being a minority, right? And coming from a family that is suffering from all of the leading causes. So high blood pressure, cancer, heart disease. So, I can go down the top 10, and I have that in my family, right? And have an experience working in those communities where this is a trend as well. And COVID exposing all of these inequities. This is at that root. And so for me, even personal, just even with that I mentioned, I just lost the first cousin
I'm sorry.
in May from COVID. And also my dad passed away in November.
Oh, I'm sorry.
As a casualty of COVID. He didn't die from COVID, but he had vascular dementia. And because of the shutdown, he was in a long-term care facility. And because of the lack of contact from people visiting him, his decline decreased in less than 6 months. He was talking, he was active, but because of lack of contact, he declined. So all of those issues, health disparities, hit all together and just has brought it all to the forefront. So for me, this pain is personal. And none of my education could do anything to change this.
Yeah. That's such a profound point. You can't study your way out of feeling.
No. And can't make an impact on it. And I know of plenty of other healthcare providers that feel the exact same way. COVID, there's not a lot that we have been able to do to impact this the way that we want to.
Exactly. I think you bring up a good point about the excising or the expunging of all of these systems that have so many holes. I mean, if you could even call it a system, for many people, there isn't even a system to fall into, let alone fall out of. So
it is a revamping of the entire system.
Right. No small feat for sure, but something I think that every nurse looking at it from whatever their perspective is, looking into it or being in it, can agree on for sure. How, in that same feeling, how do you think that we can be addressing healthcare disparities? Like, and maybe a nurse watching this, a nursing student, someone that's at the bedside at the moment, feeling completely overwhelmed. What do you think our personal responsibility and abilities are that we can all be addressing this?
Get into the communities. Talk to the people. Talk to the community leaders, the churches, the community organizations like NAACP, Urban League, patient advocacy groups like Black Women's Health Initiative or UNIDOS, schools, universities, HBCUs,
Yeah.
you go where the people are.
Yeah. Yeah.
That's where they need the most help.
Right.
To impact these health disparities and these inequities, because access is typically and is the biggest issue. And we know, as far as with the social determinants of health, impacting, as far as their environment, we'll talk about that. Okay, well, you need to eat better. Well, if there's a food desert,
right. Right.
You can't expect for them to eat better if there's not a healthy grocery store.
Yeah.
So no, that's an issue. Okay, well, you need to exercise. Well, if it's not safe for them to run in their neighborhood, you can't expect that. Or if there's not even a good park in their area.
Right. Yeah.
No. And if they're, and again, with the healthcare system, if they can't even have the transportation to even get to, a really good healthcare system.
Yeah.
Access.
Yeah. Yeah.
On all of those areas that I just mentioned.
Right.
Those are issues for all of these individuals.
Right.
So bringing the healthcare to them, talking to these people, and asking them what do they need, making it personal to them, is perhaps probably one of the very smallest and basic steps that could help impact health disparities.
Right. I used to always have a nursing instructor that said, you have 2 ears and 1 mouth for a reason. You have to listen first before you can impart what you know on anybody else. And that you bring up a good point with that, with education, access, logistics, and relationship building as the foundation for all of those things to begin with. I mean, that's
absolutely.
Yeah. A community like NurseDeck, an online community, what do you think we can be doing for nurses to help them with, specifically what you just answered there? Being an online community, are we still able to get out into, quote, the belly to belly community, or grasp that feeling? Being virtual.
I definitely think so. I would say it's a great voice to be able to articulate our concerns, or maybe even to celebrate one another. I just even, I've been a nurse for 20 years now, and that, that statement for nursing is that we're always known for eating our young, but we can rewrite that history.
Yeah.
And have a platform like this where we can celebrate each other, the young and the old, the new and the seasoned, so that we don't have to have that that old history of being known for that.
Yeah, the way we've always done it.
Exactly.
It doesn't have to be that way. Yeah.
No.
Yeah, I will say we have a questionnaire that we give to nurses in a series we call In the Field. And one of the questions people love to answer, they can choose which questions to answer, and everybody loves to answer that one. But I've been surprised at the answers coming back, because I thought it would, I feel like when I was in school, it was a hands down yes, they do it, you go through it, it's a rite of passage, don't you do it, but just beware of it. And now I feel the answers are different, coming back from the younger nurses coming up. So that's been really heartwarming to see. It gives me hope for the new generation. As a healthcare professional, what does DE&I mean to you? Diversity, equity, inclusion, and what can we do to improve the state of that?
I get when I think about DE&I, right? I read a quote that once said that diversity is being invited to the party, and inclusion is being asked to dance.
Oh, I love that.
I do too. I love when I actually heard that, and it always stuck with me.
Yeah.
So when I'm doing any work around that DNI,
Hmm.
DEI, initiatives, that's what I always think about.
Hmm. Yeah.
Is that quote. So I believe that more conversations are needed in this area,
Hmm.
and so that I believe that even more education is needed for healthcare professionals,
Yeah.
especially at that university level,
Yeah.
especially while healthcare providers are in training.
Hmm.
And I'm talking about all healthcare
Oh,
providers.
yes.
And so
Yes.
doctors, nurses, nurse practitioners,
Yep.
physician assistants,
Yeah.
respiratory therapists, anyone that touches
Mhm.
patients' lives
Yeah.
should be getting
Yeah.
more education. So, again, being that I am a former professor, there is not many, many hours that are spent towards the subject matter.
Hmm.
And
Hmm.
I do know that this is on the increase.
Hmm.
That this education is being put forth
Hmm.
around the subject matter, but it's only a few hours.
Hmm.
And
That.
so,
If that.
a
Yeah.
couple hours, a couple chapters, maybe in a textbook or something like
Hmm.
that, but it's only a couple hours.
Yeah.
I believe that this should be a course
Yeah.
that they're doing
Yeah.
so that we are actually changing the whole trajectory of how
Mhm.
patients are being treated,
Yeah.
because this has to change
Yeah.
for patients.
Yeah. Agreed. Agreed. I feel like even in nursing school, it could be woven into the curriculum of any subject, whether it's pediatrics or mental health or, just any standard nursing course, I feel deserves a, a chapter or two on how it
Mhm.
affects that patient population, because it really, it's everyone. Um,
Exactly.
so what's one benefit of diversity in nursing? Why do we need diversity in nursing? Why do we need all the dancers at the party?
I mean, I think one, because we are the reflection of the patients that we're caring for.
Hmm. Yeah.
And I think also because we as well, we have, because our work requires teamwork.
Hmm.
And so for effective teamwork, we also need to have diverse perspective, voices,
Yeah.
and ideas as well.
Yeah. Yep. That's perfect, succinct answer. I love it. Um, what areas do you think that NurseDeck can advocate more in to help the nursing community? Are there subjects that you think are being ignored, like we talked about at the very start? The buzzword of healthcare disparities right now. How can we advocate more? What topics should we be covering that are useful, applicable for nurses right now?
I wouldn't say that there's anything that is being ignored, or any lack of. I would just say continue.
Okay. Don't let it die out with the trending
Exactly.
Twitter topic.
Exactly. Kind of like, again, it's the hot girl, at the party, what I mean, and that we're just paying attention to her now.
Hmm.
But then, when everything dies down and it's not the cool thing anymore,
Right.
that, okay, well, we're going to move on to something else now.
Hmm.
No,
Hmm.
continue the good work.
Yeah.
So continue to advocate for diverse perspectives in health equity and disparities, and even take this further, because I think a lot of times, we believe that health equity and disparities and these issues are always a black and white, dynamic, and black and white kind of issues. And we know that this country is such a melting pot.
Hmm.
And so maybe even advocate and even kind of bring up more issues that impact beyond just the Black community, and even start to talk about even more that are impacting the Hispanic, the Asian, American Indian, Hawaiian, take it, me and the Americans, Samoan,
Mm-hmm.
take it even further about the diverse community that is impacting,
Right.
the global
Right.
world, what we're talking about right now, with the refugees and the Afghans
Mm-hmm.
that are coming. What are things that could be impacting, the global world and the patients that we will all be taking care of?
Yeah. Yep. Okay, great. Um, as far as nurses advocating for themselves, I mean, we hear a lot, again, another trending topic is self-care, mental well-being, nurses that are so far beyond being burnt out. I don't even think that is an adequate explanation for what they're feeling, physically, mentally, emotionally. What tips do you have for nurses on how to advocate for themselves?
It's, there was something that I kind of was thinking about. And this is even just for my own self when I'm thinking about when you're advocating for yourself, or even when you're advocating for others. Um, I think about the Homeland Security.
Mm-hmm.
When you're at the airport, if you see something, say something.
Yeah, yeah.
So
Right.
even if you kind of modify that, if you feel something,
Yeah,
say something.
yeah. That's great. I love
So
that.
I would internalize that. That's how you can advocate for yourself. That's
Mm-hmm.
how you can advocate for your peers.
Mm-hmm.
Because again, as COVID has impacted all of us,
Mm-hmm.
we are all intertwined together, and so we're all seeing how this is impacting each other.
Yeah.
So if you see that your coworker is struggling, if you
Mm-hmm.
see that your family member is struggling, if you see that even yourself you're struggling,
Mm-hmm.
if you feel something,
Mm-hmm.
say something
Yeah.
so that you can get the needed help, so that you can talk to someone,
Right.
so that when the stuff is hitting the fan,
Yeah.
then you're too far down the down the
Yeah.
road, and then you're really struggling.
Yeah.
No, early intervention,
Yeah. Right.
and you can get the help then.
Yeah. Right.
So
I think,
that's how what I would say to all of my fellow nurses. you
yeah,
know
that's great.
get the get the work, get the help as soon as you can.
I love that analogy. It makes me think of, back in the gosh, when was it? The early aughts, the Homeland Security system they used to have with the red level, orange level, like how scared do I have to be today? Let me check the level. But it's good to know where your level is at,
Mhm.
on a personal, aspect, and then being able, like you said, recognizing it and having the language to support other nurses when you recognize the signs in them, but also yourself. Yeah,
Absolutely.
that's a great analogy. I like that. Um, Staffing, one of the nurses' favorite subjects to talk about, for good reason. What future changes do you see coming for nurses staffing? Do you think it's going to take lobbying Congress and mobilizing nurses together with either nursing associations or unions? How are we going to get safe staffing ratios? Or retain nurses? Maybe we could just start there. keep the ones we have.
I I think this is going to be really tough, a tough hill to climb, because of the impact, that COVID has created for us. Um, so, with the shortages and the PTSD and the burnout, um, it's, so to be perfectly honest, I'm not even really sure um, what the landscape is going to look like, and what will be what will be the best solution. I'm in Texas, and so I've heard of various solutions of hospitals um, giving, for the nurses that are currently there, giving um, bonuses.
Mm-hmm.
I mean, retention bonuses,
Right.
not the bonuses to get people to come,
Right.
but large retention bonuses just to
Yeah.
get them to stay. Um, so, what I have felt, for me personally, I feel like me who us that are not at the bedside,
Mm-hmm.
I am trying to do my part to educate the people
Mm-hmm.
in the community to help decrease vaccine hesitancy,
Yeah. Right.
so that I can help decrease the amount of people that are coming to the hospital,
Mm-hmm.
so that can help decrease the burden for my brothers and sisters
Mm-hmm.
that are at the bedside.
Right.
That's my only way of thinking how I can contribute
Right.
to this, because, to be very honest, I don't know of any other way to get us out of this.
Yeah. Right. I mean, I think nurse retention was already something that was looming on the horizon, and it just took COVID to really, as we've talked about other issues, bring it to the surface,
Mhm.
so that it can't be ignored when you have half your unit staff leaving. Um, but it at this point, I mean, we're so reactive right now with COVID, as we have to be, that I just hope that once, hopefully,
Mhm.
we get to a point where we can come up for air, that we don't forget where we've been with all of this, you know?
It,
Um,
it, and I haven't been, so far gone from teaching um, and seen the joy of my students, why they went to nursing school, why they want to be at the bedside, that passion. So I think this pandemic has just created a whole new burden,
mhm.
for again, me and my brothers and sisters at the bedside. And when you add that additional layer of individuals who are distrusting the medical system
Mhm.
itself
Mhm.
and not wanting to believe the science,
Mhm.
um, that makes it difficult for us who are trying to give the care to them.
Mhm. Right.
And so then it's like, well, then why am I doing this
Right.
for you? So then that's the conundrum
Right.
that I think a lot of healthcare providers and nurses run into is, I want to help,
Right.
but then are you willing to help yourself?
Yeah. Right.
That's the
Especially with,
partnership. It's a
yeah.
partnership. It should be
Yeah.
a partnership in this.
Yeah.
And you're not willing to do your part.
Right. Yeah. No, that's such a good point. And I think we are so driven with preventative medicine,
Mhm.
and vaccines being one of the biggest preventative
Killers.
medicine, yeah, out there. I see the frustration with nurses with that, because that's your wheelhouse, that's your role, and with that being not taken away, but you're fighting such an uphill battle, like you said. I think it's nurses are having to get creative to connect with people, and
Mhm.
and regain their trust, or gain it in the first place. That's such a good point. Yeah, I mean, I think everything that you're saying is that I'm hearing you say is these big global problems. 2020 was the year of the nurse, and it was not the way we thought it was going to be. But I'm hoping in the long run, as we look back on this in 20 years, that we say, like, this is where all the things got tossed up into the air and where they landed. Each person took what was closest to them and ran with it. But it's really from a grassroots position. Like you were saying, you can only really affect change with the people standing side by side with you, I think. So I hope that we're creating something like that with NurseDeck, even virtually. And I thank you so much for your time this morning talking about very complex and nuanced issues. Is there anything else that you would like to touch on, topics or issues that we haven't talked about?
No, I think this was very comprehensive, and touched on, again, like I said, all of the current, issues that everyone is discussing at this time. So, no, thank you for the opportunity.
I have one last question for you. So
Yes.
your pediatric itch in the beginning of your career, I know that you worked in pediatrics as a nurse practitioner. Do you feel like, I don't want to say got it out of your system, do you still have that soft spot for pediatrics?
It never leaves.
Yeah.
And probably one of my biggest regrets, even now, and I don't have regrets. I'm not one of those people. Usually a lot of my decisions are very strategic. But one of my regrets is that I did not specialize as a neonatal nurse practitioner.
No kidding. The little itty bitties of the biddies. Wow.
Because I was a NICU nurse. That's where I started my career, was as a NICU nurse. And so that is my regret, because I probably, if I had done that, that would have been one of those shift moments. I probably wouldn't be where I am now had I made that decision.
Interesting. Yeah. That's a special class of nurses right there, I must say. All the practice. We had a couple NICU little ones. So, and even just going through as like the grower feeders, it was, you hear everything going on, or it just, from a nurse and a new mom, my jaw was like on the floor half the time.
That was that area was really my niche. Was the grower feeders. I didn't want to do too many with the vents and ECMO and all that, but once they came off, on oxygen in the hood, and let me do all the education to get them ready to send home. One of my babies I had for 9 months.
Wow. I mean, that's a relationship right there.
Watch them, help them walk.
Yeah. Awesome. Well, thank you so much for being with us, and we'll be in touch for follow-up with all of this. And I hope you have a beautiful rest of your day.
No, thank you. It was my pleasure.
Nice to meet you.
Nice to meet you.